All right, welcome everyone. I believe we have been having a great time since we started the summit, and we are about to have another mind-blowing section with Dr. Chinomso Nwozichi, a professor of nursing at Kennesaw State University, Georgia, USA. And I would like to read his bio before it starts. So, Dr. Chinomso Nwozichi, PhD RN, CMSRN, OCN, FAAN, is an accomplished oncology nurse, researcher, and educator with over a decade of experience in cancer care. Currently a professor of nursing at Kennesaw State University, where he develops, coordinates, and teaches the advanced pathophysiology course in the nurse practitioners program. Before moving to the United States of America, he served as the postgraduate coordinator of the MSc and PhD nursing programs at Babcock University, and also the head of Department of Nursing at Olabisi Onabanjo University. Dr. Nwozichi focuses on improving cancer care outcomes through evidence-based research, particularly for underserved populations. His expertise spans chemotherapy, immunotherapy, and oncology nursing education, with a specific interest in addressing treatment-related complications and advocating for cancer patients. Dr. Nwozichi has made significant contributions to oncology nursing practice in Nigeria and globally through his leadership of the Partner-to-Partner Peer Support Initiative, improving spousal support and quality of life for women with breast and gynecological cancers. His current research also involves developing and validating the Time Toxicity Index, the TACTIT, for cancer care. An inductee, I believe he's no longer is a fully fledged associate or member of American Academy of Nursing, FAAN. He has received multiple awards for his work, including recognition for his contributions to nursing education and cancer care research. In addition to his academic and research roles, Dr. Nwozichi has published numerous peer-reviewed articles and serves on editorial boards of several international oncology journals. His mentorship extends to both graduate and undergraduate nursing students, and his research has garnered attention for its impact on global cancer care practices. Ladies and gentlemen, with a clapping ovation, perhaps you can use an emoji in the chat box. Please let's receive Dr. Chinomso Nwozichi, Professor of Nursing, Kennesaw State University, Georgia, USA, as he presents tonight on positioning for a successful nursing career in the future of healthcare. Doctor, we can have you now. Thank you, sir.
All right. Thank you so much for having me, and it's a pleasure to speak among this great group of people. Um, I'm really not gonna do a whole lot of presentation, and I will do a little bit and then give opportunity for discussions. Because most times when we do one-way discussion, one-way presentation, it does not really drive the message home. So quickly, I will talk a little bit on the topic that says positioning for a successful nursing career in the future of healthcare. And the theme for the whole program is shaping the future of nursing. Now, when we are talking about the future, we are looking ahead. We are forward-thinking nurses, even though what happens today is what drives what happens in the future. All right, by way of introduction, these are the things I'm going to talk about briefly. Like I said, I'm not going to spend too much time presenting. We are going to talk about the evolving role of nursing, understanding the healthcare landscape, developing essential skills for the future, and how to position ourselves and set ourselves up for success within the nursing career. Now, we know that the healthcare landscape has actually been evolving over time. And currently, there are a lot of opportunities for men, not only men, in nursing generally. By the way, I did not set out to be a nurse originally. I wanted to be a medical doctor. And I tried a couple of times. Um, the initial time I passed my JAMB, it didn't work out. The second time I passed my JAMB, I went to University of Ilorin to study medicine, but at the end of the day, my name did not come up. And then that was when they started the post-UTME. So what did they ask me during the post-UTME? Just to write my WAEC result, mathematics A, chemistry B, physics C, just like that. And that was all we did. And we wrote it in pencil. So eventually we knew what had happened during that course. Then after 3 years, going to the fourth year, somebody just told me, why not study nursing? I said, nursing? Why will I do nursing? Nursing, a male doing nursing. It was actually strange. Interestingly, I had an older brother who was also in nursing school that was in Babcock University at that time. So he was one that encouraged me, okay, am I not a man? I'm doing nursing. Why can't you do it? I said, well, let me try it. There's no big deal. Then I started out. Initially, I would hide when I'm on the line with no other nursing students. I would hide. I wasn't comfortable until later on I started appreciating the inherent benefits of being a nurse. Although I had to battle with the issue of being a male nurse among multitude of females. So that was what I had to grapple with over a period of time until I had to come out of my shell and really showed who I am, regardless of my gender or where I was from. So now there are opportunities that are even emerging as we continue in the healthcare that male nurses can actually leverage on to advance their career. Now we have technologies that are advancing, patient needs are changing, they are becoming more complex. Nurses are even emerging as indispensable leaders in the healthcare team. Now, nurses are becoming vital members of the healthcare team. So there are emerging opportunities. However, if we do not position ourselves very well, those opportunities may elude us. And that's why we need to really understand how we can position ourselves in order to leverage on these available opportunities and grow as nurses. All right, historically, we've always known that nursing has been a female-dominated profession. And that has given males a little bit of disadvantage over the years, right? I studied midwifery. I'm a midwife by training, but I stopped practicing midwifery because of we know within the Nigerian context, it's really difficult for a male nurse to become a midwife, to practice as a midwife. There are sometimes I practiced at Adeoyo Maternity Center. Now I think it's called the teaching hospital. At that time, I'll be ready to take a delivery, and the woman will come and say, no, she does not want me. And over time, that gave me a lot of issues. So I decided to drop midwifery totally, even though I renew my license on daily basis or monthly on 3 yearly basis. But regardless, I still don't practice midwifery. I taught midwifery over a period of years until I developed a new passion for oncology, and that's how I diversified into oncology. So, but then nowadays, men are beginning to enter the field. When I was in school, we had just, I think it was just, no, my older brother's class, they were just four males out of many females. My own class, it was 12. But nowadays, we have more nurses coming up. So things are changing. And although we are still being withheld by the fact that it's still a female-dominated profession, but there is still revolution going on within the nursing field. Now, what are those barriers that we face as males? There's often stereotypes among men in nursing, and those stereotypes can be in different forms. You see, some people call me Uncle Nurse. You know, some people call me, when I tell them I'm a midwife, they say I'm a mid husband. A lot of stereotypes attached to gender when it comes to nursing practice, and sometimes it does not all go well with males. And some people have also seen male nurses. Some of them, they say they are gay, a kind of, because they are exposed to so many things. And some people say they are promiscuous. to an extent. So these are the stereotypes that male nurses have to deal with. There's also limited opportunity for role models in nursing from males because we are limited and we don't have enough male nurses. So we have little role models that can mentor other male nurses. Now, they also have to navigate biases, especially when it comes to misperception. Some people think male nurses are only there to carry heavy weight, to carry heavy patients, and that is the only. And some people even think that male nurses are not caring enough. When we talk about caring, caring is often associated with females and not males. And then there's always gender disparity when it comes to promotion to leadership. We have more females than males when it comes to leadership. So these are things we have to grapple with, we have to deal with on daily basis. So, however, regardless of these difficulties, regardless of these barriers that we've mentioned already, there are enormous opportunities that we can leverage in order to grow and advance in our career. Now, male nurses are becoming in high demand in different areas, in clinical practice, in leadership roles, in research. There is growing demand for male nurses. Coupled with that, we are having aging population within our communities. I know it's not really that bad in Nigeria, but here in the United States, the aging population is rising, and the new ones are not, people are no longer giving birth. So now we have many aged people that require even male nurses to handle. So these are areas that call for innovations when it comes to training male nurses within the nursing profession. Now there's expanding scope of practice. Male nurses do not only have to deal with clinical practice or checking vital signs. They could also be in informatics. They could also be in research, like I am. I found my niche in nursing research and education. There are also telehealth that we are testing to see how we can advance clinical practice. Now, in my facility, there's what we call virtual nursing. Virtual nursing are those who do not deal with patients directly physically. They may stay in their homes with their screen. They are monitoring the patient, checking the patient, documenting patient charts, doing a lot of things without necessarily reaching out to the patient in person. So these are roles, expanded roles that male nurses could leverage in order to advance their practice. And there's also opportunity to mentor the next generation of nurses. So male nurses can also serve as mentors to younger ones. I've mentored a lot of people. I'm still mentoring them, and I encourage them at every point in time to live out the best of themselves. That they should emerge as their authentic self at all times. They should not be surprised by whatever the society brings. They should live the authentic self, and they will grow continually. So, like I said earlier, men are increasingly choosing nursing now. So the point is no longer are there males in nursing. I remember when I was in nursing school, my dean then was very old, and I thought maybe he was not a nurse. Perhaps he was maybe a doctor that became my dean. I eventually realized that he was a nurse. How can an old person be a nurse at that time? So, which means males have been in nursing for a long time. So it's just that we didn't know much about it until recently when there's an influx of male nurses within the profession. So right now we've grown up to 12%. Before it was less than that. We've grown up to 12% are male nurses within the nursing profession, and the trend is seen globally, not only in the United States, even in Nigeria, in Asia, and different places. So we are growing. And then there is also advanced practice, like I told us earlier. There is opportunity for nurse practitioners. There's opportunity for male nurses to become clinical nurse specialists, become nurse anesthetists. That is areas where they are going into because checking vital signs, trying to clean a patient buttocks, or those messy parts of clinical nursing may be a drawback for a male nurse, although some people don't care. But these are factors that are evidence-based that have been identified that draw male nurses backward from nursing. But there are newer roles that they can leverage on, such as being a nurse practitioner. Nurse practitioners, I read recently that the Nursing and Midwifery Council of Nigeria is now starting to introduce the nurse practitioner role, which I 100% support. Okay. Yeah, what they do is they assess, they diagnose, they treat, they prescribe, just like physicians, but they do not have advanced role like physicians, but they are still advanced, but sometimes they may be regulated by a physician until when they become advanced. There are other clinical nurse specialists that can also prescribe, that do diagnosis, other tests, and all that. Now, anesthesia is another role that male nurses are really leveraging on. Anesthesia, because anesthesia, you have to do, you are an advanced practitioner, but your specific focus in anesthesia, and I think they are the one of the highest paid nurses here in the United States. Yeah, you have to go to 3 years school, consecutive 3 years, and then you can't work while schooling when you are in the School of Anesthesia here in the United States. So it's a big deal. But when they graduate, they have unlimited possibilities that they can grow and make their money, advance their career, and live their better selves. All right. Now, I have talked about all these catchy things, how you different roles that nurses can leverage on, different areas that you can go, while the challenges male nurses face and the opportunities that are embedded therein. However, if these opportunities are they are available to us at all times, okay? But if you do not position yourself, you may not, those opportunities may elude one if one is not careful. And that's why you have to position yourself carefully towards a particular focus so that you will leverage this opportunity and grow extensively within your field of nursing, within the field of nursing. So positioning ourselves for success in the nursing field requires a combination of multifactorial variables, including personal development, professional engagement, and a commitment to lifelong learning. Now, the first thing I'm going to talk about under the things you need to do to position yourself for success in nursing is to pursue continuing education. I cannot overemphasize this. Pursuing continuing education is one of the most critical steps to follow. Now, nursing began as a diploma program. It was a hospital-based, trained by doctors, trained by consultants, and then when you graduate, you now come and serve them. But over time, we had a degree program, a bachelor's degree program, that people had advanced knowledge and they got their degrees. But nursing now has moved beyond the bachelor's. We went to the master's level and then a PhD level. Here in the United States, we have the DNP. It's called the Doctor of Nursing Practice. There are studies about nursing practice itself, whereas the PhD deal with both nursing practice and research. Okay, so you have to leverage on these opportunities and advance your education. You can't remain where you are and want to have a better progress within the field. You cannot. Nowadays, before they recruit, now you see you must have a BSc, at least a bachelor's degree in nursing. So if you have only RN, it's a good thing. Yeah, you can start from somewhere, but please make sure you advance to a higher level. Get your bachelor's. Don't wait on bachelor's alone. Get your master's and get your PhD or DNP as the case may be. Okay. Now, certification is also, by the way, just talking about advanced degree. After I did my BSN, my RN, RM, public health, my bachelor's in nursing, I proceeded, even though it was very tough for me, but I proceeded to do my master's. And after my master's, I worked for a little while. I also proceeded to do my PhD. Now, one would think, oh, after PhD, it's a terminal degree, by the way. But, after PhD, I worked, I'm doing fine. Even the opportunities I have, I can't use them all alone. I can't use them because it's enormous. But however, if I told you that right now I'm enrolled in another school with a new master's, but the reason is I want to become a nurse practitioner. So I'm getting a new master's to become a family nurse practitioner. Not that I want to practice family nurse practitioner or start diagnosing or treating people. No, but because of my research trajectory, I need access to patients as a provider. Okay, so you see how because of what I need to do in future, I had to go back to school. Even with my PhD, I teach masters, I teach PhD students. I mentored a lot of people over the years, even right now, but I'm still in school doing family nurse practitioner MSc. That's to tell you that education cannot, there's no limit to education. There's no limit to advanced degree. There's no limit to what you can do in future. Now, certification is also something else you need to look at. Certification includes those things that make you specialized, that make you a specialist in a particular area. For example, some of us are general nursing, RM, but you may be certified in a particular area. For me, because my interest in oncology, I had to get certified in oncology. So I'm a oncology certified nurse. Now, my master's was actually in med-surg, but with in addition to my master's, I had to do a certification in medical surgical nursing. If you check my credential, you'll see the certified medical surgical RN. All right. So you have to demonstrate expertise, regardless of even you having advanced degree. But those certifications keep your memory fresh, make you a specialty in a particular area, and you continue that way. And it also increases your credibility within the field of nursing. So you have to also engage in continuing education. Yesterday, I had a continuing education on how to manage non-small cell lung carcinoma using immunotherapy. Okay, so I got a 3 unit credit from it because these are areas that interest me. So you have to, education does not only have to deal with when you are renewing your licenses, and that's the mistake Nigerian nurses make. Most people are only interested in continuing education only because it aids them to to renew their licenses. So we need to change that. Let's seek online resources. There are some that are free. Let's seek opportunities like you are doing now. It's very, very great. Okay. Now, the next one is to cultivate clinical expertise. Now, you need to gain diverse experience. Just a little background about me. When I moved to the United States, I've worked, in Nigeria, in India, in the Philippines, and all that. So when I came to the United States, I already had my PhD. But then I said, if I go into teaching and research immediately, even though I know I adapt so easily to different situations, but I made a decision. I had to go, I got a job as an RN. I worked in a clinical area. I used that opportunity to learn, to gain clinical experience within the American context. All right. I gained experience. I learned a lot of things. I was so confident in my approach to nursing within the American system. So when I was comfortable, I had to move down to the educational setting and research, and it has been a great experience. Now, someone will say, how can somebody with a PhD? I have mentored over like you read in my bio, I was a head of department in Olabisi Onabanjo University. I have mentored many people in Nigeria. I tell people the registrar of the Nursing and Midwifery Council was my student. It's yeah. When I tell people they don't really believe. They'll say, "You are so young. How come you have made so much impact?" Well, it's when you position yourself rightly, you make greater impact. So now, having those portfolio coming to the United States, I decided, well, let me go to the clinical side. I worked like a new grad. I learned and unlearned the things I knew before. and then I have to stay current with the current clinical practice. Okay, so sometimes you have to be humble, be loyal, learn things before you advance. Because sometimes if you rush and go straight into certain things, you might be stuck. So it's also one of the things you need to put into consideration. Now, you also have to form strong professional network. You have to join nursing organizations such as, example, Sigma Theta Tau. For me now, as an oncology nurse, I'm training oncology nurses in Nigeria. I'm mentoring thousands of nurses. Now, I founded the Oncology Nursing Society of Nigeria. All right. So we are encouraging people to join. Those who are interested in oncology to join. Let's advance it. Next year, I'll be physically present in Nigeria for a conference we are organizing. So yeah, these are things you nurses can join because when you join, not only for personal benefit, but you establish contacts and connections. Some of those connections are formidable. They are very strong that they can be the goal that will push you to the next level. You attend conferences, not only when they pay for you, can pay for yourself or seek out funds or scholarships. Seek mentors. I had a lot of mentors. Some of the mentors were active, some were inactive. I just did it passive. They were my passive mentors, but I had mentors. I had people I was looking up to, and I was modeling myself towards their direction until later on I had to use my own style because I was already strong on my ground. So you have to seek mentors. Don't just stay on your own. Look for somebody, and yeah, look for somebody. And one more mistake we make when we are seeking mentors is that we always look for people that will do things for us. And it's a problem nurses have, especially the younger ones. When somebody is a mentor, all you need to do, all you always tell them is, please, sir, can you sign this for me? Please, sir, can you help me check this? You don't always ask, what can I do for you? I know you've been doing things for me. Is there anything I can help you do? Now that actually establishes a connection between you and your mentor. Currently have a mentee that I work with. Now it started as a mentor-mentee relationship, but now it has even advanced beyond that. That even I see opportunities I send to her as a female. I send to her, I give her things that she needs. And sometimes she'll wake up and tell me, is there anything I can do for you today? I'm available today. I can do anything. And I say, okay, help me work on this, help me do things. So that is how the connection continues to grow until do you know that mentors can give you great opportunities? The job I'm currently doing right now, I did not apply. I was previously in Texas. I was working in I lived in St. David's in South Austin. That's the capital of Texas. Now, the job I'm working on was a tourist that heard about me and then sent me an email to go to Georgia that they need me somewhere. And I went, and that's how they took all my credentials and they recruited me. Now, that was because I had a mentor, because I was also engaged in nursing theory. So that's how a mentor can actually give you an opportunity that you do not really expect. And when you're getting a mentor, be intentional, not just get somebody who you think is older. It's not about age. You could get a mentor who is younger than you. But if they have advanced knowledge in a particular area, which you can leverage, that is it. Now, advanced leadership and advocacy, you must take up leadership roles. Some problems we have in Nigeria is that we are so engrossed in our clinical practice that we forget to, engage in leadership roles. Some of these leadership roles are by they are pro bono. Nobody pays for them. So if they call you, give you an opportunity to lead, when there's no money involved, many people will say, "Oh, what's my own? I'm busy, my children, and things like that." But that is not how it works. Okay. I live in the United States. My family is in the United States, but I'm still leading back in Nigeria. I was the vice president for Sigma Theta Tau in Nigeria and also the vice president in my chapter here in the United States. So there are a lot of things you can do to show your leadership skills. And leadership sometimes it's not because you know it all, but it could be a learning field for you. Then also engage in advocacy. initiative, look for something new that you are adding to the bringing to the table. Somebody will know you for this, and that's why when I heard about the first time, and I must confess, the first time I heard about insurance nursing, it sounded weird to me originally. I said, what's this insurance nursing? It didn't really make sense to me. Okay, until I continue hearing Mr. Pelumi's post. I see his posts on daily basis and see all he does. It started making sense. And then anytime I see anything insurance nursing, the first thing that comes to my mind is Mr. Pelumi. Now, you see, he has created a brand for himself, and people know him for that, even though originally it didn't make sense to me. But with constant modification to his tactics, it has now become a brand for him. So this is one of the initiatives that we always want nurses to know. For me, I wrote a research recently on time toxicity in cancer care, and this is the first time a nurse is working on this. It has not even been worked on before. Currently, I'm developing a tool so that we can measure how time burden or temporal burdens, how it affects our cancer patients and also impact their quality of life. It's a novel research that I'm working on. So it's a product of initiative that you want to use to address a particular gap in clinical or patient care. So focus on personal development. Your communication skills are very important. Okay. This is an area I want to emphasize. Communication is important, both verbal and written communication, because if you want to advance in practice, you can't always want to be a local champion. You want to be able to communicate with people not only within your local area, in somewhere in the village, in the east or in the west or somewhere in the north or somewhere in Taraba. You have to modify the way you present things so that anybody will be able to understand you and people can follow along. Recently, one doctor, I think her name is Dr. Zainab Baguda. I'm not sure exactly about her name. She was appointed as the president-elect of the UICC, which is a global organization for cancer care. Now, she is somebody from somewhere in Northeast, and now she will be leading the entire world within the cancer space. Now, she's a Nigerian. She has developed herself. She has modified and refined herself to the extent that she is found credible and worthy to become a world leader. I remember the first time when I moved to the United States, I became a professor. I could not, imagine somebody who was trained in Nigeria, a local person, a village boy, a farmer. My parents were farmers, so I grew up being a farmer. Is now training American nurses. Not just the undergraduate student, I train graduate students and even the nurse practitioners. I train them because I am the part of physiology expert. Now, if I do not modify or refine myself in terms of communication, there will be a lot of issues. Now, the way you communicate to a Nigerian is different from how you communicate to people from different areas. So you also have to adjust accordingly so that your communication skills will be according to the expectation within the different context. Time management is very, very important. And that's one of the areas I wanted to fight Mr. Pelumi when it comes to time management. I take time management as a priority for me. Now you learn to prioritize your time, learn to fix things well, and balance your responsibilities. People ask me, how do you do the things you do? If I tell you the list of the things I do on daily basis, you say it's a lie. I have my family, I have kids, I have my wife, is also a nurse. So, with all those responsibilities, how am I able to achieve the things I achieve? It's a matter of time management. So, if you want to progress, if you want to advance in your nursing career, time management is a very important skill. Resilience and well-being should also you need to pay attention to it because your personal self-care and mental health are also a priority. Now, embracing technology and innovation, you have to be tech savvy. You have to be tech savvy. Because there's nothing you do now, either locally or internationally, that does not require technology. Okay. Um, for example, you are attending a conference on Zoom, just like we are attending. There are things you shouldn't be told. For example, as you join a group or a platform, make sure you mute yourself. These are courtesy that you can't do without. You mute yourself, or if you want to talk, you talk. After talking, you mute. These are things that make you people to take us seriously. I'll take you seriously. When you are in a meeting, in a global meeting, you can't be unmuted and be talking different personal things, laughing, and so these are things we need to pay attention to. We'll learn technology. We should not always say, "Oh, I am an old school." There's nothing like old school. I have a colleague in my office that is almost, I think she's 95 years. She comes to school, she comes to work every day that she has something to do. She uses our digital platforms, she teaches, she does everything. So if a 95 person is able to navigate the technology world, how much more a younger person? So we need to be innovative at the same time. Look for projects that we can do that people will say, interesting. I get a lot of proposals from different people when it comes to research. They tell me, I want to work on this research. I look at it, I do not see innovation in this research. So sometimes it's not always good to do things for the sake of doing it. You ask yourself, what is the novelty within this idea? And this will also propel, give you the momentum to continue within that project. Research, I can't overemphasize it because that is my area. You have to continue participating in research. I live, I eat, I drink research on daily basis. Okay, so you need to participate in research. You join a research group. Even on your own, try to learn something new. How to write ordinary literature review, how to even review somebody else's paper or critique somebody else's paper. It starts gradually. Research is one of the weirdest things nurses like to do, but it's also one of the highest opportunity for you to advance. Okay, now people are getting, I here in the United States, there's a lot of money being poured into research. People are getting millions of dollars. Um, just to coordinate a group of 8 students in just a small research that I'm doing. My school gave me $10,000 just to do one small research to train undergraduate students just for 3 or 4 months. That is just incredible. So there are inherent opportunities because people don't like it. So when somebody people don't like it, there's always opportunity in what people don't like to do. And then there's nothing we can do in nursing without research because research gives us the informed decision that we make to advance whatever we do. We've been talking about evidence-based practice. We have to need to learn how to publish and present. Some of us are scared of presenting our research. Now, it's always good to start from somewhere. I remember my first publication that I published many years ago, over 13 years ago. It was like it was, I was so excited about that publication. But now when I look at it, I will ask myself, did you really do this work? Did you really publish this nonsense? It was like nonsense to me. It's now like nonsense to me, but then it was a best thing that I've ever done. So you can start from little. Don't be scared of starting from somewhere. Some people always say, "Oh, my work is not good. I'm not comfortable." Just present it. Let people critique it. You build on it, and that's how you continue to grow. You can't be born now and you start working. You start from somewhere. Okay? And then seek recognition and build a personal brand. It is not a bad thing to seek recognition and build a personal brand. You can go for awards and honors. Let people recognize you for one thing, because no matter how little it is something. Yeah, I remember in my CV, I used to put best lecturer because I got an award as the best lecturer in Babcock University for 2 consecutive years. I got an award But now I do not even include that because more words are coming in. So I see those ones. Hello? Hello? Is my time up?
No, sir. No, sir.
All right. All right. So yeah, you need to aim for awards and honors. It's not a crime to tell somebody, can you nominate me for this award that is coming? It's not a crime. But let that person who is nominating you know the worth of what you do. Recently, I was given an award as a fellow of the American Academy of Nursing, which is the highest recognition in nursing in the United States. But now it has transversed, beyond the borders of the US. People from all over the world are now being recognized by for their contributions in nursing. Okay. Now, you also have to maintain a professional portfolio. Let people know what you do and have a documentation of all your achievements, all your certifications, all your contributions. You should document them succinctly. Some people have attended conferences, but if you ask them to show evidence of it, they can't. What then is the essence of those things? And that's the problem we have. We do not document. We do a lot of things as nurses, but we don't document them. We don't keep record of them, and they die and they get missing in transit. So then you need to document all these things, put them in place. For example, I was sleeping one day. Somebody called me, can you send your CV? I woke up, I only did one or two modifications, and that was it. But there are people I will tell now, send me your CV. That CV will not be up to date. Even before I did this presentation, I still looked at my CV and I updated the continuing education I did yesterday. That is how you continue to grow your work, and then it's even easier for you to think, reflect on the things you've done in the past, okay? And then you see the trajectory, the trend, and see the areas you need to advance more or areas you need to put more effort into. And then public speaking is also a very good skill that we must develop as nurses. I must confess also that I had a problem with public speaking. I told somebody a few days ago that if somebody would tell me that I will stand in front of 1,000 people to speak, I would say it's not possible. I had a phobia for public speaking. Okay, until many years ago, I said, what is going on? And the first time I tried to come up, because most times when I see that I'm about to be called, I will hide, I'll run away, and so that nobody will call me to come and talk in public. But then I kept suffering in silence until one day I said, no, when anything that will happen, let it happen. I started gradually, and now I speak in public. I speak anywhere I want to speak. Anywhere I want to speak. Before, I could not even speak like I'm speaking to you now. It was a problem. So you need to build that. It was an intentional act. So you need to enhance your public speaking skills and become a thought leader in nursing so that people can rely on you to get the information about certain things. Okay. Now engage in community and global health. Community outreaches are important. It's not only to work in the clinical area in the hospital. Community outreaches, go out, develop health literacy programs, teach people about health, teach people about something. It does not only have to be health, or it could be something directly or indirectly related to health, such as global warming, such as conservation of the community, such a different thing, peace building activities. Let us engage in community and global activities, okay? And join global missions, such as if you see any mission that is going USAID or UNESCO or anything that has a role to play, or sometimes WHO brings some activities in Nigeria, we need to leverage those things because you don't know how you can connect with somebody or something, and then those can advance you. So be flexible and adaptable and also engage in collaboration. You work alongside other people, but you should not take nonsense from other people. Okay? But you make sure you set boundaries and also set limits. But then you have to work harmoniously regardless. And this will make people to believe you and you sound credible among them. So I've talked about this already. Our financial planning and career advancement is very, very important. Financial planning is very important because if you are branding yourself without finances, without planning yourself, you are not going to be a good leader. So these are areas you set financial goals, create a budget for things you do, and then look for how you can meet those budgets. Okay, adjust your spending, adjust your income. You work around your finances. It's very, very vital. Now, as a call to action, I'm rounding up now. You need to commit to lifelong learning, advocate for gender equity in nursing so that males, we can always stand for our fellow male nurses. You mentor young nurses and support professional organizations. You must be a visible leader in healthcare. Let the world know you. If you go, some of us do not have accounts on LinkedIn. Some of us do not have web visibility, and you want the world to know you. The other day, I got a call from somebody I did not know. They only reached me on LinkedIn, and they were giving me an opportunity. In January, I have a workshop I'm attending in San Antonio, in Texas. I did not know me, but they just read my profile and said you'll be a good fit for this program. And they booked my flight. I live in Georgia, but I'll be going to Texas. They booked my flight, my hotel, everything has been booked. So you have to make sure that you have web visibility. You are a visible leader. If you do something, let people know it. It's not about singing your praises. You are allowed to sing your praises. Go on LinkedIn. I am pleased to announce that I've been able to achieve this. It's not a bad idea. Gradually, people will get to know you and know what you stand for. Okay, so we seek leadership opportunities. We mentor young ones. We create mentorship programs, just like Mr. Pelumi is doing now. Then you look for areas that you need to close the gap within the healthcare field. Now, by embracing innovation, adaptability, and a patient-centered focus, male nurses can actually position themselves for a successful career in the future of healthcare. Thank you so much for listening. Is there Are there any questions or any comments or clarification? I'm more than happy to address those. Thank you.
Thank you so much, Doctor. This is very elaborate and precise. Thank you so much for sharing from your wealth of experience with us. I believe we have a few questions to ask. If you have questions, please, you can drop it in the chat box. Please, you are face to face with a leader in the profession, a global leader in the profession. This is your opportunity to ask questions. Do not hesitate to ask questions. So can you drop your question in the chat box? Somebody said you literally made everything very simple. And that's right,
Thank you
you
for
were
that
able
kind
to
comment.
help us understand complex things in simple ways. Thank you so much, sir. So, all right, sir. So I want to ask, sir, in advocating for gender equity in nursing, what are the baits we can use? Let's say you are speaking to secondary school students who may not necessarily know that men or guys can study nursing. So what are the baits? Because generally people think that nursing is about care, and women are better with care than men. So what are the baits? What are the converting points? What are the points, to actually submit to somebody, that males, are actually needed in the profession, and there could be gender diversity and equity in the profession?
Okay, thank you so much. That's a great question. And then the way I would address this question is by saying that most times we lead by example. Sometimes if you want to tell if maybe your child wants to study music or wants to study theater arts and other people don't like it, but you like it. One of the ways you can convince that child is by telling her, you see, do you know Jennifer? Jennifer, Funke Akindele, you see, she studied theater arts. And you see how she's doing well. Do you also know Ramsey Noah? You know, we always point to particular examples of people who have been successful within that context. For example, when you make reference to a male nurse who is really leading innovations in nursing, that could actually be a way to motivate male nurses. But if you keep telling them that male nurses are, we are all equal, equality is not being perceived. Equality is being experienced, is being visualized, is being internalized. So they say that male nurses are doing things, and that's why we are encouraging those of us that are already in nursing to continue to continue to exceed the boundaries. We should continue to to live our authentic selves. However, continue to seek further progression within our field, so that when people look at us, they look up to us. I have so many people who are now in nursing because they perceive me to be successful and they decide, oh, I want to be like him. All right, that is one way that we can really address this thing. The male nurses that we have now, we should continue to motivate them to not just settle for the minimum, but they should always look for ways to advance and progress within their field. When male nurses are becoming administrators, we see male nurses doing research, doing great things. Other male nurses will see them as, this is another male nurse, so I want to be like him. You see many people will want to join. Also, I like the idea of Male in Nursing as an organization. Actually, I started something Male in Nursing back in 20, I think it was 2016, 2016, 2017. 2006, 2007, sorry. I started an organization, but then, as a young person, as a young nurse, nobody took us serious, and that was how the organization died. And I didn't really progress with that. We have males in nursing in the United States, and that association is a very, very formidable association. So if we can have an association of males, and males continue to advance themselves, people will become visible within the healthcare space, more male nurses will be interested in joining us. I met with the former president of American Nursing Association, Dr. Brad Grant. Yeah, he's a male nurse, and his idea is to continue to attract more male nurses within the field by going everywhere, speaking to secondary schools. And when they see him and all his accomplishments, people will be motivated. People are not motivated by maybe you telling them I'm a male nurse. No. Who are you as a male nurse? What have you achieved? What spectacular thing have you done? And when you tell them what you have done and they ask you, you're a male nurse, and you say yes, that alone is a motivation for many people. So I think that's one thing I can say regarding your question. I see another question that says, my question is, how did you navigate your path in nursing to this point? Have you always wanted to be a lecturer? Have you ever envisioned yourself to relocate to America? Okay, I will answer them in bits. How did I navigate my path? Like I told you that I wanted to be a medical doctor, right? Um, when after 3, 4 years, medical doctor did not work, and somebody by chance somebody encouraged me to do nursing. At a point, the first year I did nursing, I did not do well. My first semester was very, very poor. Second semester was poor. And then I wanted to withdraw. No, third semester, I said, why, if I'm already in nursing, why can't I just give my best? Instead of just wallowing in silence, I said, well, I am here, and I'm not going anywhere. By the way, I came from a poor, well, let me not say poor, but a low income family. My mother was a farmer. Um, she had 8 children, and 6 of us went to Babcock, and 4 of us are nurses. So you can see how tight, how tough it was at that point for everybody to be in Babcock University, which was one of the most expensive university in Nigeria at that time. Okay, 4 people or 5 people at the same time. And then, so there was no time for me to start wasting my parents' money. So I said, no, I am here already. Let me focus on what I'm doing. So that's when I picked up. So I picked up, continued advancing, until it was time for nursing council, no, hospital finals. People that did hospital finals before failed. So I was so scared of failing and I didn't want to spend extra year in school. I moved from nursing to public health because I was so scared. And then after a few weeks, I said, why did I move to public health? Whatever it is, let it be. I came back to nursing again, and that's how I did, and I graduated. So when I graduated, I also still wanted to do medicine until the vice chancellor and the dean of Babcock University called me that they wanted me to come to Babcock. They had been seeing some qualities in me that I did not even know I had. So, me working as a lecturer was not by design. I told you I had problems speaking in public, but for somebody to call me, the vice chancellor and the dean of his school to call me to come to teach was an honor that I said I'm not going to. I already gotten an admission to study medicine at OAU, but I said no. Let me. Who knows why I am being called to come back to lecture, and that is how I started my lecturing journey. It was I did not apply. I did not envisage it from the onset. It was just by design. However, because I was already at that point in time, I didn't want to start playing around it. So I focused on my work, focused on my projection. Remember, I had wanted to be a doctor because I loved the title doctor then. I said, even though I'm still in nursing, I'll still gain that title and still achieve whatever I want to achieve. I became the head of department of a government university, gave them accreditation, both Nursing Council and NUC. I was on a board with consultants. I was on a board with doctors making decisions as a young nurse. So is they say when you wash your hands well, you will dine with the kings. And that is why I keep telling you, advancing, let people know what you stand for. It's always the way. When they see what you stand for, nobody would push you away. But when you're always saying, sir, and you are not advancing your degree, even with PhD, if you are not committed to a particular course, you are still not going to make headway. So you need to be focused, you need to be strategic in how you position yourself. Have you ever envisioned yourself relocating to America? Absolutely no. Absolutely no. Even when I became an American US nurse, I was still in Nigeria. I was the postgraduate coordinator of Babcock, training nurses, because that was my newfound love. Training nurses. I have trained thousands of nurses, your leaders. Many of your leaders pass through me. It's not about bragging, but sometimes it's good to brag. Let people get motivated by what you have done. Directors of nursing, head of institutions, I have trained them from different angles. If I mention names, it will be personal, but just to not to so over the years, I realized that okay, I'm doing well. I needed exposure so that I can go at my commitment will not only be in Nigeria. It was because of that I had to relocate so that I can go to America, go to US. Next week now I'm going to Canada. I'm taking my family to Canada. Yeah. So because of that, I needed that open space. If I had remained in Nigeria, I would be confined to Nigeria, and that's not what I want. So that's why I had to relocate in America, and it has given me that wide opportunity to go to any length. Next year, April, I'll be in Australia for a conference. Next week, I'm going to Canada. January, I'm going to Texas. So there are endless opportunities. What has been the most impactful decision you've made in your career, and how can someone aspiring to work on an international level make similar strategic choices? Okay, now, um, it's I think a little bit of personality and a little bit of hard work really contributed to the things I've done so far. I was doing my PhD when I decided I needed to move to the United States. So at that point, I did my NCLEX while doing PhD. Some of us now, when you tell them, prepare for NCLEX, prepare for this, they'll say, I'm so busy. I'm telling you, I did my NCLEX when I was extremely busy. But because I was focused, and that's one of the important decisions I've ever made in my life. So I prepared within 3 or 4 weeks. So I defended my PhD today. My NCLEX was in the next 3 days. And immediately I wrote the NCLEX, I entered the aeroplane and came back to Nigeria. So it was even Nigeria I knew I had passed. So because I was focused, I had a direction. It was not a matter of choice, maybe or maybe not. I was saying it's a do or die affair. Well, not to that extent, but it's something I had focused my mind to do, and that was why I achieved it. So, can someone aspiring work on an international level? You can work on at any level if you position yourself rightly. You can't be doing the same thing and expect a new result. Try something else. Try something else. If your goal is to reach only people around your community, fine. But my own goal was not just about around my community. I needed to advance to any level that I wanted. And I knew that America would give me that opportunity. And that's why I focused on America, and I'm doing extremely well. People are calling me from different places. I tell them, well, I'm busy at the moment. I can get back to you later on. I'm telling you the truth. And everything is not actually about money, but the money is still important, which is there. So you can always position yourself. You can be strategic. Look at where you want to be in the next 2 years. Now, because my research, I love researching oncology. My work is in oncology, but because I'm not a medical doctor, I'm not a nurse practitioner in the United States, I cannot really do the type of research I would want to do to collect patient sample, run them in the lab, because I teach pathophysiology and I know a lot of cell biology, cell physiology, all the mutations that occur that lead to cancer. But then I'm not a provider. So what did I do? I had to enroll into a school for me to get a nurse practitioner's degree and then become a provider. And then I can continue doing my research. You see how strategic I've always been. It does not come on a platter of gold. It does not come readily available. You have to be strategic. You have to work for it. And you also have to, pray about it. Of course, I believe in prayers, but I also believe in hard work. Yeah. So, in the clinical setting, how do we bring male nurses to the limelight in a gender-biased profession like ours? Now, things are changing right now. It's no longer as bad as it used to be. Where we have problem is recruiting male nurses to choose nursing as a profession. But when they become nurses, some of them do really, really well. I must say, some of them do really well. Yeah, the problem is to how to recruit more male nurses. So that's why we need to form an association where we can have male nurses association where male nurses can meet maybe once a month. Let's talk about what's going on. If you have any achievement, let us know so that we can celebrate it and share it to others. We can go for outreach. Maybe once in a month, we'll look for a secondary school that we can go and make a program and teach them what we know, what we are doing, showcase some of our works. That can bring in more interest in nursing among male nurses. Someone like me who has planned to work with either UN be a pathology lecturer or research, like what area can someone be advised to take after your BSc? See, um, World Cancer Congress in Geneva happened, I think it was in October. I missed it because of my fellowship in Washington, D.C. I invited to the World Cancer Congress in Geneva, but I turned it down because I had a conflicting program. Now, there is no limit. In When is that's the International Council of Nursing. They have their conference in Helsinki. That's in Finland next year. I'll be presenting there. Now, it's not about looking at I want to work with UN or African Union or wherever. What do people know you for? Because these things are competitive. They are competitive. So you have to be a visible leader. People have to know what you stand for, and they are the ones that would even recruit. People would even find you credible for recommendation. Many people that wanted to work with United Nations are not working with United Nations. It's not those that worked in United Nations did not even project that they wanted to work in United Nations. But because of the trajectory of their work, they now see them fit and credible for a higher role. So you have to plan yourself so that the world will see what you do, what you stand for. And then when you have a good mentor, don't just choose any type of mentor. Choose mentors that you know that their career trajectory that suits yours, and then go with them. They will give you introduction. For example, I had a presentation one time and I could not go. I sent one of my mentees. They paid her, I think it was 100K. I gave her everything and added 20K to it for telling her thank you for representing me. You see how there was also another one, a Sigma program. They paid another person. They paid her was it not 25,000? So this alone, this exposure by virtue of being my mentee will also expose them to a higher platform, and people will see them. And one day, if they can't reach me, the next person they will reach will be my mentee. I say, oh, we know that your mentor is busy. Can you do this for us? And that is how somebody blows. You know, what makes you blow is just one particular thing. You won't know what, but continue to project yourself. Let people know what you stand for. Don't always say, I'm busy. I gave you an instance that I have kids, I have family, I'm extremely busy, but I still find time to do the things that make me a professional. So your personal stories are inspiring. Thank you so much. Yeah. Have you met managed care nurses in America? Well, we have nurse navigators. We don't call them managed care nurses. We have nurse navigators. We have transition. We have nurse navigators. They are the ones that transition patient from inpatient to outpatient, and we also have insurance, but we don't call them insurance nurses. We call them I can't remember the exact word they use for them. They are, I think it's even managed care nurses. Yeah, I'm not sure exactly, but we
Yes,
have.
it's managed care nurse.
Yeah, absolutely. Yeah. What they do is they're the ones that when they look at your insurance request, they read your nurse, the nurse's note, the doctor's note to see whether the insurance request matches what has been done to the patient. And they're the ones that will now recommend for approval of insurance reimbursement. So there are a lot of nurses who are into that role. Yeah. Yeah. So, what's your experience with health insurance in America? Well, health insurance is a very big it's a very big field in America. 3 days ago, they killed the CEO of one major health insurance because they make a lot of money. Some of them, the CEO make up to $30 million in a year. Okay, they make money. So it's really now nurses are becoming in charge. Nurses are now they are we have nurses who own health insurance outfits. They start gradually and they grow. They have nurses who they do medical documentation. They have those who specialize in medical documentation. They read the transcript of the doctors. All the nurses know that you've done and determine how much should be paid for a patient admission. It's a specialized role. It's you have to be trained for that. So yeah, but then the health insurance business itself is not only a nursing thing. We have the those with MBAs, we have those with our different fields. But then the role of the nurse is sacrosanct. Yeah.
All right.
So
Thank you so
yeah,
much. Please, I want to ask, should in case you know nurses who work in the health insurance space in America, because my long-term goal is actually to get American exposure of the health insurance space and then be able to own an health insurance company here in Nigeria. So, but I've been looking for international nurses who work in the health insurance space in America, in Australia, but I've not been able to connect one-on-one with any. So I know you would have influence and you would be able to have connect with a pool of nurses there. So, should in case you know anybody who works as an health insurance nurse, a managed care nurse in America, we'll be glad if you can connect us.
absolutely. I will. I was during the Thanksgiving break 2 weeks ago, I still spoke with a friend well, my classmate in Bangkok, but we happen to both live in Georgia. So she came to visit me. So we're talking about it. Because she wants to also go into health insurance or managed care field as a nurse. Yeah, but you have to go for a specialized training. So I could connect you with her. She will have a better understanding of what it entails.
Yeah. Thank you
Yeah,
so much.
no problems.
It's really been a beautiful time with you, sir. Thank you so much for distilling complex issues into simple terms for every one of us to understand. So this has been a great and an impactful session with you. We'll get the recording and the slides, and we can't wait to have another opportunity of learning from you. So I also want to ask, how do you give rooms for networking with you? How can they message you on LinkedIn or which platform?
Well, I'm on LinkedIn. I'm very active. I'm sure, Mr. Akimbade, you know that I'm very active on LinkedIn. Yeah, LinkedIn, it's a platform that every nurse should be engaged in. Not Facebook. My Facebook has just been deactivated. But my LinkedIn is my professional identity. So yeah, you can reach me on LinkedIn or on WhatsApp. Is it okay if I share my number here, my WhatsApp number?
Yes, it's okay, sir.
Now, let me also okay. Let me also sound this note of caution. I have received thousands of requests as a mentorship request, but I do not like people who are not committed. So yeah, I will give you a test of commitment to see the type of commitment. If you are the one that they send you a message today, the next time you read the message is in 3 days or 4 days. No, 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 I don't work. I don't do that because you have to. I know internet may be an issue, but not for 3 days without reading your message, without replying an email. It does not work that way. Yeah, so I need people who are active, who are also ready to advance. I have many already, I must confess. But I also need people who are intentional, not just for the sake of it looks sweet, it looks flashy. No, for the sake of you wanting to better yourself, you also have to be committed to that. Yeah. So
All
I've
right, sir.
shared. Yeah.
We can get your number already. Thank you so much. We really appreciate this privilege of access, and please extend our regards to your family, and
Thank you
I'll
so
also
much.
be in your.
No,
Thank
no
you so
problems.
much.
No problem. Thank you so much. I appreciate. So I will send the link to you, the video recording when it's ready. I'll send it to you. Okay.
All right, sir. Thank you.
All
Yes, sir.
right. Thank you. And bye for now.